Today we will discuss about nerves of lower limb. So in lower limb there are three main nerves: sciatic nerves, femoral nerves and obturator nerves. So sciatic nerve, which is originate from sacral plexus by fusion of the ventral rami of spinal nerve lumbar 4 to sacral 3. If we see the picture of sacral plexus, which is formed by ventral rami of the sacral spinal nerves sacral 1 to sacral 4 and also contribute from lumbar spinal nerves lumbar 4 and lumbar 5. So there are many nerves in which is formed from this plexus, but main nerves is sciatic nerve, which has two parts, the peroneal part and the tibial nerve. Also there is an important nerve, pudendal nerve. So if we see the course of sciatic nerve, after originating from sacral plexus, the nerve emerge through the greater sciatic foramen below the piriformis muscle and then enter into the posterior aspect of thigh. We see the cut end of long head of biceps femoris muscle. The nerve passes through the muscle. We also see other muscles of posterior aspect of thigh, which are called hamstring muscle, semitendinosus, semimembranosus. Then it enters the posterior aspect of knee and divided into two nerves, the tibial nerves and the common peroneal or common femoral nerves. So the tibial nerves supply the posterior aspect of leg and sole. If we see the course of tibial nerve, it passes through the gastrocnemius muscle. We see the cut end of gastrocnemius. Then through the soleus muscle we see the cut end of soleus, and over the tibialis posterior muscle. We also see another two muscles of posterior aspect of leg, flexor digitorum longus and other muscle. If we see the common peroneal nerves which winds around the femoral neck, we see the course of the common femoral nerve. It supplies the anterior aspect and lateral aspect of leg by dividing into two nerves, the deep peroneal nerves which supply the anterior aspect, superficial peroneal nerves which supply the lateral aspect of leg. We see in this picture the cut end of femoralis longus muscle and the nerve, common femoral nerve, which after pass through this muscle divide into two parts. Then we see some muscle in this picture. Then we see the lumbar plexus, which is formed by lumbar spinal nerves lumbar 1 to lumbar 4 and some contributions from thoracic 12. And in this plexus the main nerves is femoral nerve and obturator nerve and also the lumbar sacral trunk. So if we see the picture, the femoral nerve after originating from lumbar plexus, it passes over the iliacus muscle and also we see the psoas major muscle. It passes through the femoral canal. It passes through the femoral canal and enter the end and supply the anterior aspect of thigh. Then we see another picture, the obturator nerve, which supply the medial aspect of thigh. We see in this picture the obturator nerve, which passes through the obturator foramen and some muscle of medial compartment of thigh that are called adductor muscle, adductor brevis, adductor longus, adductor magnus and the gracilis muscle. Then we see some minor nerves of lower limb. First of all, we discuss about the saphenous nerve. Saphenous nerve is a sensory nerve that travels down the medial part of thigh and providing sensation to the medial lower leg and foot. It is a branch of femoral nerves. So we see. Then we talk about the sural nerves, which is formed by from two nerves, medial sural and lateral sural nerves. Medial sural nerves is a branch of tibial nerve, and lateral sural nerve branch of common femoral nerve. Then we see another two nerves, medial plantar nerves and lateral plantar nerves, which is a branch of tibial nerves, and calcaneal nerves. The medial calcaneal nerves is a branch of tibial nerve, and the lateral calcaneal nerves is a branch of sural nerves. Another nerves, the superficial peroneal nerves and deep peroneal nerves. The superficial peroneal nerves has two branches, which is called the medial and intermediate dorsal cutaneous nerve. Then we see the sensory supply of leg. Uh, in this picture we see the medial aspect of leg supplied by saphenous nerve. The anterior aspect mainly supplied by superficial peroneal nerves. The lateral aspect of leg is also supplied by saphenous and medial sural nerves. The posterior lateral aspect of leg is supplied by sural nerves. Then we see another nerves, the posterior femoral cutaneous nerve, which is also known as laser sciatic nerve. It is a branch originated from the sacral plexus. In this picture, we see the sensory supply of thigh. The posterior aspect mainly supplied by posterior cutaneous nerve of thigh, and the anterior aspect femoral nerve, and the lateral aspect by lateral cutaneous nerve of thigh. Thank you all.